Hello, and welcome to the Green Voice podcast, where you can get all the dirt on sustainability in Pittsburgh, Pennsylvania. I'm your host, Grant Ervin with S&B USA, where I serve as the Director of ESG and Innovation. Today, we're coming to you from the UPMC Health Plan Neighborhood Center here in East Liberty, one of the great neighborhoods of the city of Pittsburgh. And I have two great guests with me here today, Holly Vogt and Ray Prushnok. Holly, Ray, how are you guys doing today?
Excellent. Thank you for having us today.
It's great to be here in this terrific space. When I was walking in, I was like, it looked familiar to me. I was like, oh yeah, I bought a bicycle here. But you guys have done a really great job in kind of transforming this space. Maybe let's start there. I want to learn more about you guys and your role. Ray, this is your second tour of duty here on the Green Voice, so thanks for coming back. You brought your friend Holly with you, so we're looking to learn more about the evolution of sustainability at UPMC. But Ray, I'm going to start with you. Maybe first, tell us a little bit about the health plan and the work that you guys are doing here at the Neighborhood Center.
Great. Well, first, Grant, thank you for the invitation back. It's delightful to be here again, and it's doubly delightful to be able to host the podcast here in our newish UPMC Health Plan Neighborhood Center. So
you've been busy since we last talked, right?
Definitely busy.
There's new paint on the walls and everything. So
yep, and as you noted, in Pittsburgh speak, it's where the performance bike used to be, right? So we are. This is a new concept for us at the health plan. It really is a embodiment of what we've been doing at the UPMC Center for Social Impact. And so, as we talked about last time, really we are focused heavily on that intersection of social needs and health. So where can we show that our members in our community can benefit from social interventions that can help improve their overall well-being. And so through this journey, we had the opportunity in partnership with Walnut Capital to take over this space. And the Neighborhood Center is a place where we have community health workers who can meet with members or people dropping in who may need assistance or help filling out an application for a program like SNAP or other assistance. We also have our Connect Center here, where people, if they have questions about their current benefits or their health plan, they can get those answered. But really, I think most importantly, this has become a convening point for community-based organizations who need a place to hold a meeting, who need to gather their board, are looking for a place to meet with their clients. So we have everything from workforce programming.
Right.
We've had dental hygienists in the building. We've had citizenship courses. So a wide variety of community organizations share this space with us. And so for our listeners, if you have an organization that you're on the board or you work for and you need a space here in the East End, please reach out.
Did you find a gap in kind of service, or what was the impetus for the creation of the center?
Yeah, it really came from our desire to have a sort of place, and we have a lot of membership, a lot of clinical resources here in the East End, and it was a new concept for us to see if we could try to draw on the community differently. So far so good. We've have literally events every day, and it's been also just a great place to come and work.
That's terrific. And then also, since we last spoke, Holly was added to the UPMC team. Holly, it's so great for you to be here with us. Tell us a little bit about Holly Vogt and kind of I'd like to know a couple things. One, your journey to UPMC, and then a little bit about your role at UPMC, and then we want to get into how you and Ray are working together. So much to talk about.
There's a lot to talk about.
Yeah, so tell me a little bit about yourself.
Yeah, so I came to this role with the Center's sustainability through leadership. So leadership was engaged by a large group of physicians who had an interest in sustainability, wanting to make sure that, as climate change and as they were seeing patients with conditions that were more severe based on air quality, environmental concerns that they were addressing, they wanted to know what their employer was doing to help be more preventative in that space. And at the same time, we also had a physician, Dr. Boninger, who had approached UPMC about his interest in sustainability work as well. So what they did is they partnered both our Chief Administrative Sustainability Officer, John Krilicki, and Dr. Boninger as the Chief Medical Sustainability Officer, and partnered them in the role to head up the Center for Sustainability. So it was really a collaborative effort on a lot of different levels to bring me into this space. So I recently joined UPMC in February with a lot of momentum and excitement for how we would establish and move forward with sustainability.
And what was your role prior to coming to UPMC? Little Birdie told me that you had some government service as well, which I think is something that we all share in common.
Yeah, absolutely. So I was the Director of Sustainability for Beaver County. I was in that role for over 12 years. So in that space, I was the recycling coordinator for Beaver County. So that was my state side of the job. And from the county perspective, we have 54 municipalities. So I worked with the local government, I worked with school districts, moving sustainability work, everything from our water conservation efforts to street lighting projects for energy efficiency to what did our buildings look like.
Right.
So I have a wide background in sustainability work.
I love it. I know the job well, having worked at the city of Pittsburgh in a similar type of role. What was your pathway into sustainability? I'm always curious to learn about that. Both of you. I mean, you guys have coming in from different angles now with your positions at UPMC, both in terms of the administration as well as in terms of the health plan. But what was your journeys into sustainability? We'll start with Holly and go to Ray.
Okay. So interestingly enough, when I took my job at Beaver County, it was in a waste management role.
Okay.
And when I realized that it's more than just managing waste, that there's more that we could be doing than just that narrow scope.
So it was really like pulling on the ball of yarn almost for
Absolutely.
you?
And as soon as it started to unravel, I realized, it wasn't just minimizing waste, but there was a lot that impacted our air quality, cleaning up our waterways, making sure that we had healthy trees and landscaping and things that really makes a difference in the lives of people. And when I realized the impact that it had from a social aspect, that had me hook, line, and sinker. Then I was all engaged. I went back to school, got my master's in sustainability from Arizona State, and that just spurred me to want to be at the corporate level, to really be in a space where I can make a difference.
That's amazing. So you continue to grow and progress
Absolutely.
in kind of your activities. That's great. It's really exciting. Ray, how about you? What was kind of your entry point?
Well, it's hard to put an entry point. I think, being environmentally conscious is something I was always, brought up with, as an outdoors person and a hunter. But I started my career with New Mexico Public Interest Research Group. So I spent some time knocking on doors for the environment and advocating on consumer issues, which was a big thread into how I landed here in social impact. So I was working on issues like predatory lending and other consumer-facing issues, but also with a heavy thread, from my employment in environmental issues, and went on to work in state service in the Pennsylvania Department of Aging. A little bit of city, county, state, right? And
we got everything covered.
Yeah,
we need somebody from like the federal side.
Federal perspective.
Right.
Yeah. So it was, I think a good, it's been an interesting career journey, I guess, going from sort of nonprofit sector to government to now the private sector for a very large nonprofit. But the common thread has been finding a way where we can make an impact.
Right.
And so while my group is focused heavily on areas that are more sort of social in the ESG world, and we've been doing a lot of work in things like affordable housing and workforce development and and nutrition, food security. There's a clear overlap with Holly's work as we're really looking to build some of those bridges.
I'd like to dig into that a little bit. It's interesting. Two things are interesting. Lots of things are interesting, but apropos to this conversation, just to see the evolution since we last spoke, Ray, in terms of the growth and the focus and the attention that UPMC is putting on these activities. Obviously, bring Holly, onto the team as a critical asset about that. What's that been like, since it's been a little over a year, we have the center here now, you have, Holly's role. How is the enterprise starting to fuse things together, I guess, and bring things together? You mentioned leadership, strategy. What's your kind of take on those?
I mean, I think that, we are, a large anchor institution. We are the community that we serve, our employees, our workforce, we're all part of this community. We all want to make a difference and make Pittsburgh and the regions we serve around Pennsylvania and across the region as strong as possible. So I think that the platform that Holly and I are lucky to have let us really focus in on some of those things, and it has an impact in all of those areas, whether it's helping to sort of be there for employee morale and sort of take on initiatives where we know, as Holly mentioned, our physicians were really looking, for sort of this kind of a beacon and being able to mobilize that.
Yeah.
Similarly, as we talked about last time with social determinants of health, we can't ignore the social needs of our members. If our members are having trouble making ends meet, they're not going to have the ability to focus on getting that primary care appointment or getting in for a visit. And that also applies to, the sort of the health at home, and whether it's ambient air quality or the food that they eat. And that's, I think, prompted us to be involved with a lot of local initiatives that require what's come to be called blending and braiding, right? So none of these things happen alone. Each initiative really is the community at large.
That's really interesting. And Holly, you mentioned kind of this intersection, that blending and braiding between the physicians and the facilities administration. Talk about that. Like, what does that look like, from your point of view in terms of both just coming into the organization, but also now a few months into the role in terms of trying to balance some of those needs of doctors and what's happening on the practice side, but also in the facilities and physical plant side?
Yeah, absolutely. So I think that from a leadership standpoint, the motivation is to engage as many people as possible. So that includes, the workforce, as well as, the patients that are coming for services, the visitors that are in and out of our facilities. We want there to be a strong mindset that sustainability matters to our organization. With that being said, we have created sustainability teams within our UPMC hospitals.
In each individual hospital?
We're rolling them out at this point. We have 24 that are engaged, so we still have a little ways to go.
Right.
But we're about 6 months in at this point with the Center for Sustainability. So what we have established is the hospital presidents have identified a key person that would be the champion at their location. The champion then reached out to basically a call to action to say, who here in this hospital would like to participate on the sustainability team?
Right.
So all of the service lines are represented. So whether you're in EVS, whether you're in food and nutrition,
EVS,
so laundry services
Okay.
and maintenance and those types of things, facilities. It's a holistic approach because we want to have voices from all the different areas. We don't want it from just one siloed area.
Right.
We want it to spread across. So with those sustainability teams, each hospital is moving their own initiatives.
Okay.
So in one hospital, they may be really concerned about single-use plastics and looking at opportunity in that space. Another, hospital may be looking at their composting program and what are they doing with their food scraps in the kitchen.
Okay.
So it's a very unique approach to this, but the idea is within the next year, we will have 100% sustainability teams at each location.
So, that's fascinating. So are you providing, from your perch, a framework for each individual hospital? So some guidelines and guide rails to help get them started? or are they really taking that initiative from the ground up, or a little bit of both?
So it is a little bit of both. So they are definitely taking initiative, but on the other hand, we did give them the framework. So each group established a charter.
Okay.
So what is the accountability and how the expectations are going to be met? We have goals established so that we can have metrics to know.
So corporate level goals.
Absolutely.
Okay.
And our strategic plan is something that is in the process. We are definitely moving along with it, and hopefully by end of year, we will have a draft ready to present back.
Okay.
That's the roadmap for where we're headed, but the metrics and the reporting is essential to us so that we can really speak to the differences that we are trying to really make.
We talk a lot about that idea around transparency and reporting. It's been a kind of continual theme here on the Green Voice when we're talking with other corporate partners. Why is that important for you as a professional leading this charge, but also for UPMC? Like, why is pulling that information and data so critical to you?
For me as a new employee to UPMC, what I found, there was so much work already being done over the years. The problem is we didn't share our story. We didn't highlight all of the hard effort and work that had been put in by the staff and by the employees that were leading those efforts. So what I want to do at this point is my excitement is, growing with each project that I hear about.
Yeah.
So I really want to, present that out to the community, letting them know that there's a lot of hard work that's taking place on the backside, that when they walk through the door, when they see something different, that they are realizing that was tied to an environmental initiative, or that was being done because of the impact that we have to our community. So those numbers really do speak volumes.
It's so important, like, to tell the story and those narratives. And I think it's interesting. I'd love to hear your reflection on this, because I've experienced the same at S&B USA where I'm at. We're in the construction industry. We're building infrastructure. We're moving dirt, and all kinds of like really intense activities that have an impact not just on our people but also the environment and the communities that we serve. And we started in the same pathway, which was, you come in, you're a new person. They're like, what's this new person here? What are they doing? What's this all about? Leadership is behind you. They see kind of the North Star as to why this is important, but you have to build that kind of capacity. And, here, once you start looking under the cover, we're finding projects where we recycled 100% of a bridge, we're, recycling fuel oil, we're building, huge green infrastructure projects. So, these really great examples, and it's like, we've been doing this, right?
Absolutely.
How much of it is just telling that these roles are telling that story? Maybe first you and then to Ray.
Yeah, absolutely. So I think that telling those stories is more of...
You're like the chief storyteller, right?
Absolutely.
Yeah.
And I think that that's what makes, even from my early days in sustainability work, was having the opportunity to highlight change happening. Change in general can be difficult for people to understand.
Right.
But when you're able to show the successes of why this made sense and why this will ultimately, for long-term value, be important, we got to get the word out there. We can't keep it in any longer.
It's an important part of change management. I mean, Ray, what's your side of that? I mean, telling the story and then having a platform at a place like this to tell it to, right?
Yeah, this is definitely, being, the storyteller for so many others. I and my small team only do, a very small part of the work that we're able to do in social impact. I think in addition to, the sort of idea of storytelling, we are, and we're able to be sort of, spokespeople. We also, are what we measure, right?
Yeah.
And so it's sort of beyond sort of that being a, bit of a, jargon, in healthcare in particular, we're very good at measurement. We're very good at metrics. And I think about like how the, sort of healthcare landscape changed since the Affordable Care Act. There are things like, never events that went into place, and you saw the entire healthcare industry respond. Readmission penalties and how the industry has responded. And then you look at areas like, the quality bonus system around Medicare and the stars, and all of these things sort of lead up to, sort of not only setting clear benchmarks, but seeing the industry sort of raise the level. I think what we're seeing
In terms of the standard of performance?
the standard of performance, and really, we're great at data, we're great at measurement, we're great at quality. And when you begin to bring some of that same discipline towards efforts like sustainability, I think we'll see a greater impact in healthcare and across many different sectors as we're still learning.
What does it look like for the two of you too? I mean, you're on two different sides of the same house, to use like that analogy. What does collaboration look like, and kind of cross-sector connections that the two of you, that you're in your roles, obviously you found each other, right? That's like a big victory. But what does that look like in terms of the day-to-day, and also, some of the things where you see the synergy starting to hit together?
Well, I mean, I think a great example is food is medicine, right? So if you look at, how, our health is impacted by having a healthy diet. And, from the health plan standpoint, we help to set up infrastructure for, our prescription for wellness program. And so through that program, our UPMC physicians, write a prescription to a patient and, give that person guidance. And what we find is that prescription from a physician is going to be far more effective than having a health coach at the health plan giving you a call. And having your physician encourage you to take a step to reach out and call that health coach, what we find is that the member or patient is more likely to take the call when we call them, and we can begin that journey about whether it's a Mediterranean diet or beginning to set some goals around your fitness and lifestyle. Similarly, within that same framework, when we look at the amount of food that we buy as a health plan, so we buy thousands upon thousands of home delivered meals.
Wow.
We have programs that are focused in on people with food sensitive chronic conditions like diabetes management, people with kidney disease. And most of that food, is going to be a flash frozen meal that's transported across the country. How do we support local food systems that help build, our local economy, as well as produce food locally? So Holly and I, for example, have been participating with the Pittsburgh Food Policy Council's latest initiative around creating a more localized food system.
And I think from, continuing with the same theme of food, I mean, how we look at food from sustainability, our cafeterias produce a lot of food within the kitchen areas.
Yep.
So starting our composting programs, we have several hospitals that are diverting large amounts of material that are compostable.
Yep.
In addition, UPMC, our 12 Pittsburgh regional hospitals have participated in the Cool Food Pledge. So again, what types of food, more plant-based diet, and we know that food in general is very heavy on emissions and how food is produced. And again, bringing it in from a local farmer as opposed to our supply chain has done a fantastic job in sustainability in general, and has been for years. But what I'm finding is how they buy products and where we're sourcing things also has a huge impact on our greenhouse gas emissions.
Scope 3 emissions.
Yeah, absolutely.
You touched on a couple of things that are super interesting. Like, one, I was going to ask you about supply chain, so I'm really glad that you brought that up. But that also pertains to these ideas of the impacts that places like UPMC has, but not just UPMC, how every business has an impact on their local communities. So talk to me about how you're looking at that from a financial perspective and what that looks like in a sustainability space, but also what are those local partnerships that you guys have to forge, whether it's like the Food Policy Council or a local farmer or vendor. What does those relationships start to look like?
Yeah, I mean, I think with anything, you're going to accelerate this work and build buy-in whenever you're able to connect it to business value.
Because you start to create demand, right?
You start to create demand. So if you're able to demonstrate that we have a program that we're launching right now with our Medicare and our Medicaid members with elevated A1C levels, managing their diabetes. And if we're able to provide them with fresh produce and we're able to see a health impact, that's a great way to demonstrate that not only doing something extraordinary, buying food with limited, healthcare dollars, can then lower healthcare costs, right? So it's sort of being able to tie that value. Now, it's maybe less direct in terms of how that sort of local food system, but I think the business value there is a lot clearer on, say, maybe our food production side.
Yeah, what does that look
Absolutely.
like from your space?
So I think that in general, we have supply chain, and it is a very diverse department that handles all different areas. What's interesting with supply chain is they have, as one of their puzzle pieces, if you will, sustainability and resiliency is plugged into that. Because again, as a health system, we have to be resilient in how we're buying and dispersing the services or the products that we're providing out to patients.
Yeah.
So essentially that has a huge impact and directly ties to the environmental impact as well as the financial bottom line, because both are important.
Have you guys seen that like through the pandemic and then post-pandemic in terms of availability of products or services? You're probably a little new to that.
I was just going to say, I don't know that I can speak to that exactly. I know that our supply chain has great partnerships with the vendors. And so if there have been issues, I haven't noticed, as much on my side of things. But I think what's important is the messaging that they're providing our vendors, that sustainability matters. So things like freight and how things are brought in, where are we getting distribution from, making sure that the supplies that we have on hand have come at the shipping for the most quantity or the most value with the less impact. So these things are all important to the supply chain as they make decisions.
One of the things that, with that too, facilities is a piece of the puzzle, and I'm just thinking about from two angles, I guess. One is the customer experience. Ray, that's a little bit on your side, is like the customer side, but from making the hospitals sustainable places. Talked a little bit about food. What does it look like from an energy or physical plant standpoint? What are some things that are kind of on the chart or in the strategy in that realm?
So I know that UPMC has always had a strong importance with how new hospitals and outpatient facilities, doctor's offices, things like that, for the green spaces within each surrounding area where a patient receives care.
Because I know that like the Vision Center, I'm sorry to interrupt, but like the Vision Center, that was a critical aspect, was just thinking about when you walk in, the experience and light and all those sorts of things versus you picture I'm picturing like a hospital movie from like the 60s or the 70s, and it's a dark space, and but now it's welcoming and inviting and but that's exciting.
Well, it's exciting, and I think that everything from, you had spoken a few minutes ago about demolition and buildings being taken down, and what are you doing with that? UPMC has in their contract how we dispose of all of the construction and demolition material. But on the flip side of that, everything that is constructed also has a green element to it. So there's standards that have to be met. UPMC East is a LEED Silver facility. Yes. And that's an amazing facility. And they have continued with that same high quality with children's, and again with the new Mercy Pavilion that just opened in May. So again, you're seeing that from the public as they're entering these spaces, they see something different. Whether they tie that to the sustainability piece of it, I don't know. But essentially, those buildings are so efficient in terms of the energy that they use and the services that are provided within them. Paint color choices, the signage, everything. Within the building has been intentionally put in place for a purpose.
From a health plan perspective, does that start to translate in what you see in terms of the user experience, like these sustainability measures that maybe subtle to the naked eye, but it's about a user experience, right?
Yeah, and that also translates to our employees. I mean, I work in the U.S. Steel Tower. Our floor is LEED certified, and I know each of our floors, as we remodel them and update them over time, have achieved different sort of LEED statuses. But it's a point of pride, I think, when I go to work and I see that my employer is making that investment.
Yeah.
And similar with all of this work that is really focused on impacting our community at large, whether it's environmental or helping to meet people's social needs. It becomes another reason why UPMC is a great employer.
Maybe just to kind of wrap this up a bit and bring it home a little, what do you guys see over the next 8 months or so in terms of both your collaboration together, but what's on the horizon from a health plan, UPMC health plan standpoint, but also from the enterprise itself? Like, what's on the near-term horizon for you all?
I've been continuing our work around affordable housing, and I see that picking up. Something that we had talked about last time was sort of our first fund with Bridgeway Capital. That fund has ultimately participated in the development of over 450 units here in sort of the greater Pittsburgh area, with 360 or so being affordable units. We recently just launched a new affordable housing effort alongside the Hillman Foundation and the Heinz Endowments. And that fund is being managed by Sinair Lending. And that's totally focused on preservation of affordable housing. And that's a exciting way where we can go into communities that may be at risk of losing some of that affordable housing and provide some low-cost capital to make sure that more mission-minded developers move in and are able to compete with the private market while keeping rents at more of an affordable range. So I see us doing a lot more in the housing area. And as I mentioned previously, I'm excited by our sort of new concepts in food as medicine, and looking for ways where we can really expand those types of efforts.
Awesome. Holly?
And I think from our standpoint, so there was a Harvard study that was done not too long ago where they showed that around 70% of people care about sustainability. And when we find for retention of employees, we want to make sure that we're addressing things that matter to them or are important to them. And we can also take that from folks that are coming for services. If 70% of them also care about sustainability, we want to be meeting them where they're at.
Right.
And bringing that voice into how we deliver services and how they can expect when they come into our facilities that our facilities are different, that we're doing things that really connect the community with achieving long-term value and goals through sustainability work.
That's amazing. Well, let's leave it there. I want to thank you, Holly, Ray, for being guests here on the Green Voice podcast. Also, just want to thank the entire team at UPMC for all the great work that they do as being such a great community partner. Your impact is felt, as you know, every day, every hour, every minute across the region. So thank you for that.
All right, thank you.
Thank you.
Excellent. Thanks for listening to the Green Voice podcast. I'm Grant Ervin with S&B USA. Thanks for listening in, and we'll check you out on the next episode. Be well.